It was an experience I never want to repeat. I was alone and I was scared. I felt as if I was a burden. I felt useless. I was in pain, real pain. Pain that prevented me from getting out of bed, moving around, contacting my friends. It brought fear and it brought dread.
Tell me about the day that you went to hospital.
At the beginning of February, I think it was the 3rd of February, I got a phone call and they said, we have a slot on Monday morning to do your knee. Can you be here? And I said, yes. They advised me to phone this number in Derry, and which I did, and I spoke to a young girl there, took all the information. I told her I was having the knee done and I'd be home a week after that. That's generally the rule. And she said, fine, I've got all this information and here's your reference number. Goodbye. And I thought, right, that's all done. Wrote it all down, took it to hospital with me. And I thought, I don't have anything else to worry about, as far as I was concerned. But I didn't really know what was down the line, what was coming at me.
So tell me about what happened following your operation.
Well, after surgery, on the second day, they get you out of bed. I said to them on Tuesday, here's the number, please start to phone for aftercare with social services. And I gave it to them, and during the day they would come in and say, we're not having any luck, they only meet on a Friday and we can't get hold of anybody, but we'll try again. And they did try for Tuesday, Wednesday and Thursday. We were getting nowhere. So we were at a real loose end. So I said to them on the Friday, please try the doctor and ask if the doctor can organise respite at our local hospital, which is only 6 miles from where I live, until I am sure on my feet. And they did. They phoned the doctor and he said he can't do anything.
So you were discharged on the Saturday, Marj. How did you get home to Fermanagh?
Yes, Saturday we decided we'd have to go on the Saturday so that we'd have time to get home and sort out. My son came round to the hospital, we got loaded up. He sorted out the car so that I could stretch out and not go over too many bumps, and we got home. And I had organised my bed and everything before I left, so he got me into bed. He made some tea, got something for supper, but I can say at that stage I wasn't eating anything. You just feel you just can't, just something to drink and lie back. He was very good in getting the telephone fixed up beside me, my laptop, all my medication and everything like that, so that it was all at hand. And he stayed overnight, so he was here on Sunday morning, checked everything, and Sunday at midday he had to leave. And he couldn't lock the door because I couldn't get up to go and answer it. And these are things I hadn't thought about. And I just lay back in the bed, and I can tell you, thinking, why haven't I been able to get care? Why is it just so difficult? It just seemed to me that I wasn't just worth the effort. The first night was a bit worrying, but I was actually at that stage quite frail because I'd lost such a lot of weight and anxious, and I just lay back in bed and thought, well, we'll just see what happens. And I timed myself getting out of bed and coming through to the kitchen, and my house is a little cottage, and it took me half an hour. Then a young girl arrived from occupational therapy, and she just wanted to know what had happened, what was my needs, and quite frankly, I hadn't a clue what I needed. But she left me a little walking aid and 2 little perching chairs, I think they're called, and that was very useful. But then she was gone, and that was the end of the story. And I just lay back in bed again and think, I don't know how I'm going to get over this and get myself back on my feet again.
How did you get through those first few days, Marj?
Well, those were really the most terrible days. I mean, even today when I think about it, I wonder, how am I going to manage? From the Sunday until the Thursday, when we got something arranged, there was nobody coming in. I had to try and manage, to try and get out of bed. I couldn't lock the door. I didn't eat anything because I simply didn't want anything. A cup of tea was all I wanted. I had 2 friends that had called in, but when you're debilitated like that, you don't talk about what's happening. You just lie back and say hello, goodbye. They made me a cup of tea and they went, and they honestly didn't know that I had no care package in place. And it wasn't till the Wednesday when a friend who comes around to help me occasionally called in, saw me in the kitchen trying to make a cup of tea, and took the matter in hand and asked for, where's all the numbers that you were phoning from? So I told her they're there by the bed, all written down. And so she started phoning, and by sheer coincidence, that she spoke to a person that she had known when they both were in other jobs earlier in their life. And this was a social worker who came round immediately because she just happened to be in the area nearby. She came in and she was horrified at the situation. She had a look round, spoke to me, and she said, I will go now and write an assessment and you will have somebody tomorrow. That would be Thursday. And that was just sheer luck that happened.
And what was the impact of this delay on your recovery?
The impact of it was I had an asthma attack when I was going into theatre, and that's just one of those things that I suffer from. It's stress related, but I wasn't having general anaesthetic, so everything was all right. And when I came home, the asthma had started to get to the stage where it was turning into bronchitis, and I needed to see a doctor, and I needed medicine to clear it up before it became serious. And because I was stressing about getting out and nobody here to help me with the leg, my leg became infected. By that stage I was sitting in the chair coughing and, not recovering as I should, and that was into the 2nd week, and I phoned the surgery and said I really must see a doctor. And my own doctor that I go to regularly did come out that afternoon immediately, and she gave me antibiotics for it, and she looked at my knee and she said, it's actually irritated because you're stressed out with the walking. But so that instead of being better by the 2nd week, I wasn't any better than the day I left hospital.
Why do you want to tell your story, Marj?
As I see it, there are hundreds of people coming out of hospital after serious surgery, and they haven't a care package in place there, or they haven't got a proper care package in place. Come Friday afternoon, people are left stranded.
Marj, I know you wrote to the Western Health Trust about your experience. What response did you get?
They didn't say, you were left and we are sorry that you were left without a care package and we can see that something needs to be done. That was not indicated in the letter, and that's what I wanted to hear.
And if you had one message that you wanted to get across after your experience, Marj, what would it be?
Well, I would like to see that before people come out of hospital, that somebody dedicated is taking care of them and making sure that they get home on time and not at 11 o'clock at night. And because I feel there are far too many older people left on their own without the proper care. And I really indicate in a lot of ways that this is what I would like to see.
In pain, scared and alone, worthless, useless, a burden. Marj's words, not mine. Marj was speaking up to try to prevent something like this happening to another older person again. Marj needed help with personal care and she needed help with medical care. But the delay in provision of an appropriate care package hindered her recovery by weeks, compromising her dignity, her independence, and left her feeling vulnerable and very unsafe in her home. Sadly, Marj's story is not an isolated incident. We simply can't let this happen again. Age&I has a vision for social care, which is quality, integrated social care that recognises the rights, aspirations and diversity of us all. And it's based on the right to live with dignity, independence, security and choice. Age&I believes, and older people have told us, that we need a joined up and coordinated health and social care system, one which responds to each person's individual needs, and a joined up approach with effective communication between older people, professionals in hospital and those in community settings. This is required to deliver an effective service for older people, particularly when they leave hospital. Central to this is the need to have one named person in charge of implementing the care plan with all the information clearly understood by the older person. Age&I believes that it is a time for change. Older people must be heard. The voices of older people must be at the centre of implementing the health and social care reforms that are needed, making better, more responsive policies and person-centred services. It is also vital that the voices of older people are centrally involved around their own individual health and social care services and treatment. And Age&I continue to strongly advocate for older people to be supported to stay in their own homes, independent, fit and healthy for as long as possible. We have seen in recent years a number of policy initiatives. For example, we have Transforming Your Care and the follow-up Donaldson report, setting out a blueprint for the future so that we all can have a world-class health and social care system in Northern Ireland. So it is time that widely accepted recommendations are resourced and implemented. And how will we know when older people have received proper health and social care? We'll ask them. We have an urgent need to change for the better, to protect older people and to agree a new way of delivering health and social care. We need to ensure that all of us have the right to live well and with dignity as we age.